Hello everyone, I am Dr. Moumita Saha. I am a Paediatric and Adolescent Endocrinologist at Fortis CDOC. Childhood obesity has now become a global pandemic. As per the recent reports, around 14 million Indian children were found to be obese, which is the second highest in the world. So what is childhood obesity? Childhood obesity is now considered as a chronic disease due to excess body fat that impairs the health and leads to long-term morbidity and mortality. So how does a child end up with obesity? So a healthy child enters into an unhealthy lifestyle with lots of screen time, no physical activity, unhealthy eating habits with fried fatty foods, sugar sweetened beverages, and starts gaining weight. In turn becomes more lazy, more sedentary lifestyle, and hence further weight gain. So this vicious cycle goes on and on, leading to progressive weight gain, obesity into adulthood, and metabolic syndrome. How do we identify obesity in children? So for children less than 5 years of age, we use weight for height. For children above 5 years of age, we use BMI. But this doesn't give us the whole picture about the body composition. For that, we have waist circumference, which reflects the abdominal adiposity and is strongly associated with cardiometabolic complications. Now, why are we so worried about childhood obesity? So it's not just about the appearance. Childhood obesity is associated with a lot of metabolic complications. Parents have often noticed a black discoloration over the back of the neck, in the armpits, and usually confuse it as tanning or dirt. But it's not a simple skin problem. This is called as acanthosis nigricans and is a sign of insulin resistance, which later leads to type 2 diabetes. Then we have dyslipidemias. The high cholesterol and triglyceride level leads to early onset of hypertension and cardiometabolic cardiac complications like coronary artery disease. Fatty liver, also known as metabolic dysfunction associated steatotic liver disease, is very common, seen in as much as 35% of the obese children. Pubertal issues like early puberty or late puberty is very common. Girls are at a high risk of PCOS. Then there can be musculoskeletal problems, sleep disorders like obstructive sleep apneas. Apart from all these, children face a lot of weight stigma, low self-esteem, and land up in depression. So if there is already obesity and obesity related complications in the family like hypertension and diabetes, the risk in children increases many more times. So childhood obesity leads to adult obesity and complications, which then becomes irreversible. So parents, don't neglect childhood obesity and get your child screened now. Early diagnosis and intervention will not only stop the progression but can also reverse it if identified timely. For a child, the parents and the family are the first teacher and role models. Your child needs a healthy start for a healthy future. So parents, are you ready to take the first step? Thank you.